Hi, I'm Gene Liu and I'm an otolaryngologist, head and neck surgeon, or ear, nose, and throat doctor here in Los Angeles. And today I'm here to talk about that little band of tissue under the lip right here called the labial frenulum, and if it's tight in a newborn, it can be a lip tie that causes problems with feeding. If the lip can't get a good seal across the top of the breast and nipple, it can be really tough to breastfeed. Sometimes babies will pop off a lot. Sometimes it's very painful as the baby overcompensates by biting or chomping down really hard. It can result in feeds where there's a lot of gulping of air. It can mean that feeds take a long time because it's very inefficient. It can also mean that there isn't much time in between feeds, and also the baby might have trouble gaining weight. If the lip has trouble flanging out a little bit and getting over the top of that breast, you can sometimes have one or two of the issues I described, and sometimes you can have all of them. At the end of the day, there are also a lot of other reasons why babies may struggle to breastfeed, but a lip tie certainly can be one of them. The most obvious situation where the lip tie is part of the problem is when the lip is constantly folded under and the baby is popping off from the top. Other times it can suggest that there's a problem if the lip sits kind of neutral and with every suck it pulls under and then the baby pops off, but when you're able to reposition and get a better seal, that the baby's better able to stay latched on and feed better. Looking at the little band of tissue under the lip gives us some idea of if it's thicker or shorter or tighter than average, but by far and away the best measure of whether or not it's causing a problem is what's happening during the actual feed. In babies where that upper lip position is really getting in the way or affecting feeding, it may make sense to snip that little band. Snipping the labial frenulum takes all of about 5 or 10 seconds. You can use scissors, you can use a laser, you can use electrocautery. Any cutting tool will work. At the end of the day, you have a little raw area there that instantly allows the lip to more easily move. Sometimes that means the baby is instantly able to get a better latch right off of the bat. Other times it means that the parents are better able to reposition the upper lip. If the decision is made to snip that little band of tissue, there are basically no risks. It hurts a little bit, kind of like accidentally biting your cheek, but it's over in about 5 or 10 seconds. There are no stitches, there are no antibiotics, there's no pain medicines. There's really no downside other than the brief owie and potentially a couple of drops of blood. An ear piercing is definitely more dangerous than what I'm talking about. After the snip, there's going to be a little bit of exercises or stretching that needs to be done to prevent it from sticking right back down again. In an older child or adult, it is as simple as sticking your tongue up in the area like this a couple of times a day. Ideally, we shoot for 4 or 5 times. There's no such thing as too much. Little tiny babies, though, aren't going to be able to stick their tongue under the lip on their own, so your best bet is to grab the lip and lift up or swipe a finger underneath. Once that raw area is healed and new skin relines the area, you can stop. But if you don't do those exercises early on, the lip will stick right back down and it will scar right back in place. So doing simple little exercises will prevent that and give you lifelong ability to move that upper lip better. Some people have concerns about that little band of tissue under the lip and what it might do to teeth and dental development. There's going to be a separate video by Dr. Kelman, a pediatric dentist, going into that in more detail. At the end of the day, if the lip tie is getting in the way of feeding or causing some pain or inefficiency, it's a super easy problem to fix. It's a lot less common than a tongue tie, but absolutely something that we occasionally come across, and it's easy to address. I hope this video was helpful. If you have any additional questions, please leave it in the comments below.